everyone. So let us today talk about the patient and family education in a surgical patient. The patient and family education starts as soon as the patient enters the hospital at the help desk or the registration desk. Here comes the education about the early warning signs in the patient. The staff needs to ask if they have any kind of early warning signs, meaning any chest pain, any dizziness, giddiness, any excessive repeated vomitings. And they need to be also told that while they are waiting for their turn for the consultation, if any of such kind of symptoms occur, then they need to bring into the notice of the registration desk or the nursing staff who's nearer to them, so that a due care can be taken and then their care can be expedited. After the registration is done, normally the patient goes to the nursing counter. Here comes the big role of nursing staff in the patient and family education. They do the vitals, take the vitals of the patient, that includes the pain score also, and they do the fall risk assessment in the OPD. Here also, when they assess the three categories in which the patient can fall, the normal low risk or the moderate risk or the high risk. Patient needs to be educated about the consequences which can occur if they fall in the category of moderate or the high risk. In fact, in even a low risk category, patients also need to be educated about the normal precautions to prevent the fall in the OPD. Normally this prevention is being done in the ward, but sometimes in the OPD it is not being done, which is mandatory. Where the score is more and the patient is in the high risk category, the patients are provided the wheelchair, and the nurse must accompany a moderate and the high risk patient to the consultant chamber, write the score on the patient card and tell the doctor that this patient falls in this category. The education is done to the patient and patient staff also, that if they are in the category of moderate and high risk, they are supposed to avoid the stairs and also take what kind of proper footwear they are wearing. If they are short sighted, they have to wear their specs. They have to avoid the slippery areas in the toilet, and in case anything they see, they have to take the help of housekeeping staff or any other hospital staff. Once into the consultation chamber, of course, the surgeons definitely share the diagnosis, what kind of type of surgery is going to be planned, the risk and complications associated with the surgery. They need to be informed what duration of the stay will be there and what will be the expected outcome. And in a case any associated other modality of treatment is required, let's say in cancer patients, many a times a pre-chemo or the post-chemo or radiation is required in the surgical patient. So they need to be told, and they need to be clear-cut told about the benefits and the risks and complication associated. Then comes, of course, if there's some kind of investigations are being ordered. So what is the why the investigations are being ordered, any special investigation required, then if any fasting status is required or any special investigation is required, like in radiological tests like CECT, contrast enhanced CT, that urea or creatinine is the pre-requirement. So it is always better if they are told at the surgeon's OPD level, so that they are prepared for with the investigation well in advance, and accordingly their appointment can be taken. If any nil per orderly status is required, that also needs to be told. Once from here the patient goes to the ward, here comes the role of the nursing team as well as the surgical team in keeping the patient and family educated about their relatives' roles. Most important thing is, of course, to prevent the fall. Again, I would like to stress upon here, the education needs to be done to them about the fall prevention, the importance of the bed rails being up, that needs to be told, importance of that they should take help of the bell whenever they want to they have any queries, or if the patient wants to go to washroom, one must take the help of the nursing staff. Another education which needs to be told is that the patient relatives need to be told if they are leaving the patient room, this needs to be informed to the nursing counter, so that nursing knows that now the patient is alone, and accordingly they will take the care. Education also needs to be done about the medication which is being given, their associated, if there is some specific concern about the medication, that needs to be told. Antibiotics when they are being given, when the test dose is being given, still they need to be told about. And if in fact in the history, even if it is no allergy history, even then they need to be told that in the rarest of the cases they still can have the reaction. Then comes the roles of diets, any restrictions of the diet. The dietitian needs to interact with the patient and patient family. They need to educate what to eat, what not to eat. In case the nil per orderly status is after some time and the patient is having the diet, then of course, let's say it's a diabetic patient, then they have to be clearly told that only the food, of course, all patient needs to have the food from the hospital, but on their own also, they should not be taking no sugar, no rice or things like that. When the patients are admitted in the hospital and they are fasting for the surgery, they need to be specifically educated about not taking any of their medication as such also. And it becomes more important in diabetic patients, because at times the patient take the medication on their own, thinking that staff has not given the medication, probably he or she has forgotten, let me take my normal medications, or even for that matter antihypertensive medicines. So they need to be educated first and foremost. No self medication is to be done. In case patients are having any queries on apprehension, they must reach out to their nursing team. Once the patient is definitely told about these things, in the pre-anesthetic checkup, the anesthesiologist needs to tell about the nil per orderly status. If there is any requirement of the blood, that is to be told at the level of surgeon as well as anesthetist, and about the pain management techniques, the type of anesthesia which will be given, will it be general anesthesia or the regional anesthesia or the combination of both, the advantages of the techniques and any risk associated with the techniques. If any central line needs to be put, then also patient and family needs to be educated about the risk and complications associated with the procedure, even though it is occurring during the surgery time when the patient is not awake most of the time, in such cases where the central lines are required. Same way goes for catheterization. They need to be educated that urinary catheter will be inserted, the technique, procedure, the possibility of irritations. Same goes for the intubation process at the level of anesthesiologist. The hoarseness in the throat can occur. They need to be educated about this aspect. In case the patient is expected to go on to the ventilator after the surgery, then the patient needs to be told beforehand gently that there will be a tube inside your mouth after the surgery and you will be on a breathing machine. You will be able to hear the voices. In case for some time, when they are coming out of the anesthesia, they need to be beforehand told that your tube will not be taken out, it will remain there, you might feel some irritation. And at the time of, even when the patient is coming out of the anesthesia, they need to be reinforce this factor to the patient again that everything is fine, please don't feel agitated or apprehensive, you are absolutely fine, you are going to meet your relative soon. That calms the patient and it really goes in a long way in a better outcome of the patients. So once the patient now in the ward already, as we had said, of course, beside everything has been talked, the importance of bowel preparation also, that also needs to be educated to the patient beforehand. The preoperative bath, even before the admission, when patient had come into the OPD, the preoperative bath at home also, so that prevents the hospital associated infection. The education of patient and family about the hand hygiene, because the staff and doctors, they will be taking care of all these hand hygiene techniques, but in case the patient and family is not educated, then the infection can occur because the way the patient or the patient family are handling themselves or their own kith and kin, even in the hospital or even afterwards. Once the surgery is done, definitely beforehand, of course, the pain management techniques had to be talked about and they need to be explained what kind of pain management techniques will be there, for how long, and that needs to be taken care of. In the post-op, when the patients are in the ward, it is very important to educate the patient and family how to take care of the patient when they are discharged, like rice tube feeding or the care of the wounds. And this can be best done if any of one of the companion or the relative who can be decided who will be taking care of the patient at home, that they are educated along with the nursing staff while they are patients are admitted in the hospital, so that they can be told about the simple techniques, how to handle the dressing, how to do the rice tube feeding, how to take the urinary catheter care in case the patient is going to be discharged on urinary catheter in certain cases. And this goes a long way in having a better outcome in the patients. Once the patient is discharged, definitely again the tracking needs to be done about any signs and symptoms of surgical site infections, and this needs to be educated in the hospital only to the patient and patient relatives, and the track has to be also done afterwards also. If they have any signs of fever or any discharge from the wound, then they must immediately come and report to the hospital, to their surgical team, and so that the due care can be taken. So there are multiple factors where the patient and family education be affected. Most important thing is doing only verbal education, patient may forget most of the things, as the patient is already so stressed up, even the relatives are stressed out. So it is always to have audio visual aids, the pamphlets to distribute to the patients risk complication, how to manage some dressing wounds, the catheter, the specific surgery related conditions, the diets, the medications, the side effects of the medications. So all these things one has to have the pamphlets, and the interaction needs to be done during when the patient has stayed, and these pamphlets also have to be given when the patient is being discharged, so that they can take care of themselves at home also in the best way. So let us all join hand together with the patients and the patient family and have a safer outcome for the patient, and safety for all, safety for surgeons, safety for nurses in being satisfied that the best care is given to their patients.